So what exactly CaReMe diseases means and why it's important?
Concept of CaReMe diseases, the knowledge of physicians and the caregivers for a long time.
You know how many renal failure patients or CKD patients?
Much more.
800 million.
People are not aware about it.
Until 90% of your kidney is gone, you don't have symptoms. And those people who have a heart disease, 40% of them will have a kidney disease.
So I just want to understand from your end or your perspective or kidney perspective.
Our aim is very clear, to have a healthy Indian life for everyone in the country.
You are the center of CaReMe diseases. So may I know about it?
We have to understand that from where it starts. So the starting point is the metabolic point.
If I regularly visit you guys, I mean regularly visit the doctors as barbers, at least monthly once.
Hey, don't compare barbers and the doctors together.
No.
Yeah,
So,
correct.
but I was not knowing it's so complicated. So
No, by the end of this podcast, we'll make it very simple.
To understand.
You asked me what are those essential eight.
Essentially. Hello everyone, this is Vibha Bhatt and welcome to the special episode of CaReMe diseases. If you or someone you love is suffering from heart diseases, kidney diseases or diabetes, so then this episode is for you. Let's understand what CaReMe stands for. Cardiovascular, renal, metabolic. They look so different but they are deeply connected. To understand this in a better way, we have three specialists in our podcast today. Let's welcome Dr. Nagraj sir. He is a heart specialist. Welcome to the show, sir.
Namaskara. My name is Dr. Nagraj Desai. I'm a cardiologist. I'm working out of my office called Namana Medical Center. And I have been in Bangalore since 42 years. And it is a pleasure to be here amongst you.
We have Dr. Sanjeev Kumar sir. He is a kidney specialist. Welcome to the show, sir.
Thank you, Vibha. It's a pleasure being here. I'm Dr. Sanjeev Kumar. I'm a consultant nephrologist and transplant physician at Sagar Hospitals, Bangalore. And I've been practicing since 25 years now. And it's nice to come to your studio, and it's a nice studio for us.
Thank you so much, sir. Welcome to the show.
Thank you.
Yeah. Let's welcome Dr. Pramila ma'am. She is a metabolism and diabetic specialist. Welcome to the show, ma'am.
Thank you, Vibha. I am Dr. Pramila Kalra. I'm working as professor and head of endocrinology at Ramaya Medical College and Memorial Hospital, Bangalore. And I'm practicing endocrinology for past 23 years now.
Oh, that's great. Thank you, ma'am. Thank
Nice to be here.
Yeah. So let's understand what exactly CaReMe diseases means. Let's ask now Dr. Nagraj sir about it. Sir, many people think that this kidney diseases, heart diseases and diabetes is a different issues. But they don't know that these all come under the CaReMe diseases. So what exactly CaReMe diseases means and why it's important?
You see, the concept of CaReMe diseases is not a very recent one or anything like that. It has been in the knowledge of physicians and the caregivers for a long time. In fact, I can take you back to 1990 when Professor Zhao and also Dr. Braunwald from Harvard Medical College developed the concept of cardiovascular continuum. It means that the population develops certain risk factors called high blood pressure, diabetes, and high cholesterol. As a consequence of that, people develop certain diseases which results in the organ dysfunction like kidney dysfunction or a brain dysfunction or a cardiac dysfunction. This leads to situations like a heart attack, which in turn can lead to heart failure and which can deteriorate into final exit from this world. In the similar manner, when the kidney gets affected, it results in kidney failure, which may require Dr. Sanjeev's attention and also resulting in renal replacement therapy called transplant. I'm sure as we go on, we will learn more about it, suggesting that a population which started off as healthy population develops certain issues, including diabetes and various other risk factors. This results in diseases, in turn results in death, and it could result in personal loss to the family, to the society, and great loss to the exchequer, to the society and the nation. So, by appreciating these CaReMe diseases, we have to put back the population in a proper, lifestyle, making sure that the diseases come down in their prevalence in our country, so that the patients benefit, families benefit, society become healthier. For this to be addressed in the podcast like this, it is advantageous because we have three specialists gathered here in front of you to answer the questions which you are going to raise. Coming to the issue of the prevalence of various varieties of this risk factor that I was talking of, for example, high blood pressure, which is so common in our country. 1 out of 5 adults is supposed to suffer from high blood pressure. In-depth study from ICMR suggested that to the extent of 30% of the individuals have certain varieties of diabetes or pre-diabetes related issues in our communities. Nearly 80% of our Indian population has some kind of cholesterol or lipid abnormalities in our population.
80%.
Yes.
Okay.
And tobacco, almost, I don't know how many of your staff smokes and how often they kind of take alcohol, how often they exercise, but they're all looking bright and young and energetic. Is good. In other words, the lifestyle diseases, as they are called, they lead to non-communicable diseases, and these risk factors can result to the non-communicable diseases which can affect the heart, kidney, and that's what we are worried about now.
Okay.
So let's go on with this conversation, because I
Definitely,
cannot stop with a few sentences like this. But suffice to
yeah.
say here that it is a kind of new bottle with an old wine. These concepts are known to us for a long time, but to make it more palatable and more presentable to the community, we call them now CaReMe
Disease.
program.
Yeah.
It is not just our invention or our kind of discovery, but it has been internationally accepted. It is called cardiorenal metabolic abnormalities. I represent cardiac, he represent kidney, and she represent metabolic. In fact, it should start from that side, in fact.
Yeah.
She starts off and we jog along with her to produce more problems. Okay?
Okay, got it.
Done.
Got it. So that means they are very internally connected, but people are not aware about it. So
Absolutely.
we think if kidney problem comes, it's only related to kidney, but we don't concentrate on the heart, or we don't concentrate on the diabetic or metabolism issues, what's happening in our body. So I think
It is too simplified. It should not be so simplified. Oversimplification is too dangerous. If you ask a nephrologist, it is not just about one risk factor like high blood pressure or diabetes causing diseases. He will have something like hundreds of diseases which can affect the kidney and causing problems. So let's restrict ourselves to how these risk factors like diabetes and related issues can cause kidney problems, and how me and him and her can advise our patients, physicians, and population to remain healthier so that they remain good for all of us.
definitely, sir. And I'm excited for the further discussion on it. Yeah. Sanjeev, sir.
Yeah.
As sir said, that Nagraj sir said that they are interlinked. Okay. So I just want to understand from your end or your perspective or kidney perspective. So how people are affected by these CaReMe diseases?
See, CaReMe is very small synonym where cardiac, renal, and metabolic.
Yeah.
It's simple.
Yeah.
Why we make it simple is to make people understand we make it simple.
Okay.
So it's a complicated process,
Okay.
but making it simple will help us to know this. This was actually started in 2009 by a few nephrologists who were into acute dialysis conference, where they coined it as cardiorenal syndrome. And then they found that, okay, this cardiorenal syndrome is basically because of the metabolism which is causing problem to us. So that's how it became as renal metabolic syndrome. Now we call this as CKM, where cardio kidney metabolism. So that R, renal, is replaced by K. So it's one of the thing where we should understand that if anyone who's having diabetes or blood pressure, it will get kidney gets affected. Kidney is a wonderful organ where it filters all the waste material except the brain. It can't filter the thoughts of a man. Definitely, it can filter all what is waste in your body.
Next point.
The other thing, what it filters is also what is good and which is not required by the body. So the functions of kidney are not just removing of waste material or excess good material. It also has functions of hormones which will give your bones make your bones much stronger. It causes good blood in you. You know, the blood comes from the erythropoietin, which is secreted in the kidney. Then your electrolytes, all the minerals what you have, what we talk about minerals, everyone you ask, anyone will be talking about minerals. All are managed by the kidney. And all these things are 24/7. There's nothing, no rest for the kidney. Two organs in the body, heart and kidney, work 24 hours, and it's in the body, and we work as outside 24 hours. So that's the life of a nephrologist and a cardiologist, I'm sure, with the metabolic guys also. So that's how cardio, renal and metabolic comes into play. They are all interlinked to each other. One can't be separated. To make people things understand, stand in front of a mirror. Okay, I'm the kidney. In front, what you see is your heart, where does the metabolism come? The lighting, what you see outside, is your metabolism. So it's a mirror image is kidney, heart, and the metabolism. So very simple. When you stand in front of mirror, please be aware that you take care of all these parameters. Otherwise, you're going to cause problem to you. To make things easier for a public, we have made this issue. Whereas once we have days, we have World Kidney Day, we have World Cardiology Day, we have World Metabolic Day, Thyroid Day, we have, I'm sure you're all aware of Valentine's Day, you're all aware of it. But when it comes to a healthy disease awareness, you're not aware, because that's not important for you. When it becomes important for you, then you try to analyze it. So anyone in the family gets affected, then you analyze it. So that's how the things fall. World Kidney Day is always celebrated on second week of Thursday every March. And we have been doing this since 2006. Every year we have one thing which will come in and we make people aware. We go to the media, we go to everyone and make sure that it is propagated well. So this is what is cardio kidney metabolism syndrome, what we are talking about. It is just to make things very nice. If you tell very nicely, then it becomes very easy, isn't it, to understand?
So that's
But the concept of that making it easy, we fight a lot.
Yeah.
We make easy things easy, we have to fight a lot to get it to normal. Our aim is very clear, to have a healthy Indian life for everyone in the country. That's our aim for all the doctors.
So that's what I said, no sir. I thought CaReMe disease, I made it very simple because you people made us simple.
Yeah,
So,
correct.
but I was not knowing it's so complicated until you guys explained about it. So
Yeah.
it's so complicated, and I am damn sure I'm also enjoying
No, by
this
the
discussion.
end of this podcast, we'll make it very simple. I'm
To
sure,
understand.
isn't it? We'll make them understand totally
Yes.
easier way.
Sir,
Okay.
as you said, we people don't know about it. I think, sir, you want to add some pointers here. So when sir said we know about the Valentine's Day, we know about others' day, but we don't know about actual our own body or health. We are not health conscious. So may I know about it?
The cardio-renal metabolic so-called the complex was usually called, or in the past it was called cardiovascular continuum, because as a cardiologist we thought that we should teach one another that this is how the seed of disease starts, this is how the organ gets affected, this is how the organ fails, this is how, despite the restoration that is taking place in the body repairs itself, in fact. Despite that, there is a progressive deterioration in the body functions, of heart, for example. So in other words, cardiovascular continuum or change to cardiovascular metabolic continuum, with the kidney joining in, it became cardio-renal or cardio-kidney metabolic continuum. In other words, it is not enough for us to comment about a particular aspect, but I'm sure in the coming questions that you are going to pose to us again, we will discuss that.
Definitely, sir, definitely. Ma'am, after the discussion with both of them, I got to know that you are the center of CaReMe diseases. Means like metabolic issues or conditions is a start of this all problems. So may I know like what is your perspective on it? Like CaReMe diseases as metabolic conditions as a center of these conditions, all of these diseases. So may I know about it?
So as we all know that, and we have discussed already, that there can be effect on the cardiac system, there can be effect on the renal system. But we have to understand that from where it starts. So the starting point is the metabolic point. So what happens that people who have obesity, who have insulin resistance, where the insulin does not work properly in the body because of obesity, because of lack of exercise, lack of lifestyle modification. So what happens, the problem starts from there. And at that point of time, dyslipidemia, cholesterol problems, other problems set in. So all these create a vicious cycle. So what vicious cycle is created? This all leads to inflammation in the body. And lot of inflammatory markers are released. Body undergoes stress. So like we say, we do daily routine work and we are stressed out. This is a different stress. This is a stress which is inside our body, which we call as oxidative stress. So once these inflammatory markers are released, the body undergoes oxidative stress. It leads to bad effect on multiple organs in the body. Now, what are these important organs? So we know that heart is a very important organ. We also know that kidney is a very important organ. So what happens, we have already discussed that, but there are some other important organs also which are affected, like the patient's eyes can be affected, nerves can be affected. So there are other organs which are affected along with these organs, but all that is a vicious cycle. So once patient has insulin resistance, over a period of time, they get diabetes. Many patients don't take the treatment properly, or even if they take it, they don't follow up properly. So they'll continue to have high glucose values. All these things further propagates this vicious cycle of insulin resistance, of inflammation in the body, oxidative stress. These things which form in our body actually cause damage. And this damage causes further damage to the heart and the kidney. And that is why we say CaReMe. So when we talk about CaReMe, so we can take it in another way also, that we say that care for metabolism. So we can use it in the sense of telling it as a disease. We should understand it that way, that if you care for the metabolism, your body will care for you, and this care, the cardiology and the renal can be taken care of. So that's why it's very important that whenever we are talking about obesity or we are talking about patient gaining weight, it doesn't mean that just patient is looking obese. There can be abdominal obesity. Patient may not look so obese. So all these factors actually start from the very beginning. So when a child is born, at that point of time, what the mother has eaten during the pregnancy also makes a difference in which diseases, which metabolic diseases, and when will the child manifest them. So apart from the genetic factors, these are important. So what happens that once the patient starts growing up or the person's child starts growing up, over a period of time, we see that a lot of these metabolic abnormalities start. And this starts in the very beginning. It's not like these metabolic abnormalities will start on one day and the next day the heart and the kidney are affected. This is a long cycle. So we have a lot of time in between that to take care of all these vicious problems which happens, or vicious cycle you can say, the vicious cycle which happens in a patient's body. And once we take care of these metabolic problems, metabolic abnormalities, we can actually retard to a great extent the damage to the kidney, to the heart and the other organs which I alluded to. But the most important factor is the metabolism has to be cared for. So that's what we say, CaReMe, care for the metabolism.
Okay. Yeah. So we have got a new name for CaReMe, as I said in the beginning. So now we got to know that CaReMe is care your metabolism. So all of you should care your metabolism. Yeah.
You can put it as the house where cardiologist is there, nephrologist is the kid, and the whole house is managed by the
Metabolism.
It's a house. So that's how you have to put that into a perspectives where people can understand.
True.
So the whole house is a metabolism. Heart is at the one, who is the owner of the house, and the children and the kidney.
The kid.
No. Not,
It's the kid, not the kidney.
yeah. In the sense, I always, felt that I'm quoting Osler here. Osler is called the father of medicine. He was a professor of medicine at various places in the West, but let's not bother about. What he said was the important responsibility of clinician is to make sure that he understands the problems of the society and take a look at the root cause of these problems and find out the beneficial effect of the medicines and the therapies that he gives and make sure that it is available to all people across the world. He also cautioned saying that it is important that the physician should educate the masses. Educate the masses not to get carried away by, unscientific, unproven therapies. So, in other words, when metabolism is being managed by various varieties of specialists nowadays, it is important that what are the proven therapies, what are unproven therapies. More about it during the next section of this discussion, I guess.
So I really want to discuss about the discussion happened in cafe actually. So as you said, so I was discussing with ma'am also. This is the first time I am in front of doctors without any symptoms and diseases. This is the first time, and for that you said one thing. So Vibha, you never go to the doctors. So once you see some symptoms, then only you go to doctors. And you talked about it in a mass. So and I related, and till now it's in my mind. So can you just help audience to know about it, sir? Like the discussion, what happened? So you said we go to saloon, we go to there. So I just want that discussion.
No. Actually, I was kind of excited by one trial on hypertension. This happened in America, and they conducted a trial to understand whether a person is taken care of by his barber, will he have a better control of blood pressure versus a physician? And they found out, to their surprise, that the barbers did a better job than the physician. I don't know how it happened. It really happened. It has been widely quoted now. What is the message here? The message is that the availability of the technology, awareness by the public, and it being simpler makes it very important impact on the health of the public. For example, barber, everybody goes. Whereas physicians, people would not like to visit them unless they are repeatedly called saying that Dr. Desai wants you to see you today, something like that. So the body system is such that there are several varieties of metabolic activities are going on in the body every second, every minute, every hour, every day, every month, every year. These are all kept in a leash, tight control, so that the blood pressure remains 130 by 80 and less. When you exercise, it becomes a little higher. When you run, it becomes more. When I exercise, my heart rate becomes more. I require energy. That's why the glucose is provided to the body cell. And in case you drink too much of water, the kidney specialist will make sure that the kidneys work well. In other words, there are several mechanisms in the body which are keeping the system in the leash control, tight leash. This is called internal milieu of the body. It is so constant. Acidity in the body is so constant. If it varies, it results in death. So that's why I say that unless one becomes symptomatic, he doesn't consult a doctor. It is a very unfortunate thing. But most of the risk factors that we are talking today, they're all asymptomatic. People do not complain. You ask a high blood pressure patient, he will hardly have any symptoms. You ask a renal disease patient, he is unless coaxed, he says he's doing fine. Diabetes is notorious, wherein people do not complain of any symptoms until the blood sugars are checked. Cholesterol levels are also same. In other words, the body system is created in such a manner that only I have pain, I go to the doctor.
There are only two things which a person comes to us. One is pain, another is fever. Others you don't come. No person comes to us as a symptoms regularly, unless it is
Yeah.
a fixed thing that you do a health checkup regularly.
Yes.
Okay.
That's where it comes, wherein in this asymptomatic phase of the clustering risk factors which can eventually cause problems, you have to have a regular visit to your barber. Or on the day of barber visit, you should have your blood pressure checked, your blood sugar checked, your cholesterol checked, your weight checked, your diet checked by your spouse, and make sure that you don't smell of tobacco or alcohol. Make sure that your waistline is properly managed.
So means these are asymptomatic.
Yes.
So but if I regularly visit you guys, I mean regularly visit the doctors as barbers, at least monthly once.
Hey, don't
You ask others.
barbers and the doctors. It's just a different quotation. Don't compare barbers to doctors. Absolutely.
It's not a comparison.
But sir has given an example.
Sir, it's not a comparison, but see,
Yeah.
so we are so concentrated on our body, hair.
External
We are so concentrated on all of these things, the external things.
No, Vibha, it's very, very important as a human mind. You're concentrating only what the public wants to see you. That's it. They don't see inside, isn't it?
Yeah.
You are diabetic, your blood pressure, they don't know. You have a kidney disease, they don't know. They don't know whether you have a problem with the eye,
Okay.
whether your eyesight, I'm not talking about the eyesight,
Yeah.
or you have any problem with the liver unless you check it out. So externally you want to make sure everything is good externally for you.
True.
As a doctor, we want you to look externally also good, internally also you should be good.
First internally good so that you
Then we can be
Yeah,
externally
that's
good.
it.
Yes.
Let's ask Dr. Pramila, by visiting you regularly, how I can be assured of my better health? What all should I do according to you?
So the thing is, see, when we are talking about regular visit to doctors, it means that you are trying to find out if there is any problem. It's just not diabetes or any metabolic problems. It can be so many other issues which might be picked up, especially the cancer screening. Because a lot of times now in our country, now people are becoming aware about regular use or regular indications for cancer screening, which are to be done as per the guidelines. When we talk about metabolic health, as Dr. Nagaraj Desai is asking, we can pick up a lot of dyslipidemias, impaired glucose values, which is called as pre-diabetes. So what happens, this is the point of time when lifestyle interventions can help. Like if we pick up these cases when they have already got type 2 diabetes or they have already got dyslipidemia with cardiac problems, that's a little bit later. So what we are trying to tell here is a primordial prevention. We are trying to intervene at the time when the disease has not set in, but there are things which are making us know or which are telling us that the disease might set in. So we have to intervene at that point of time, because that's the point of time when lifestyle modifications and some of the medications, if needed, some weight losing drugs and some other medications might help. So that's the reason primordial prevention, even before the disease starts, is important rather than when the disease already happens. That doesn't mean that when the disease already happens, we don't need to treat that. Then also we need to treat that. But the problem is that that's the point of time when already multiple problems have already set in. So it's best to treat in the beginning. And that's why so much of talk is there, that what the child is eating, what the school is offering to the child, what food is being given to the child in the school is also very important. Because parents think that my child can eat everything. My child is small, my child will not get any problem. Why should I not let my child eat the junk or so-called junk or whatever we think is good for the child, or the child should get happiness from that? But that's not the happiness. The happiness is when the child will be a healthy adult. That is the happiness. So that's what we should aim for, rather than aiming for a child who is obese and who gets diabetes at the age of 20 years.
Yes, that's right. One important thing is, I just want to add onto the discussion. It is not just about the visiting the doctor, taking action.
Absolutely.
Unless I take the action, any number of visits to Dr. Pramila would be helpful to my health. So the action will have to be taken by me, and that is an important awareness. So being aware is not enough. Taking action is also equally important. So you have to find a proper day and time and then make sure that you will not do this, you will do this, and you will make sure that your health is better than previous day or previous year.
So that means if we visit regularly and take proper actions, so then asymptomatic diseases also can be identified and taken care prior.
And prevention of diseases can be done.
Yeah.
It's more about
Prevention is
prevention.
better than
Yes,
cure.
yes. That's what
Yes.
we are talking about.
Yes, yes.
In fact, there is some group where they should come before the prevention also.
Yeah.
You have some familial diseases where you know that you are going to get the disease in future. So
Right.
before you go for prevention, it's pre-prevention.
Pre-prevention.
You have to come there. And whenever we go to a doctor, we advise. But there should be someone to make sure that you are following what we advise. That's not
That
done.
is true.
So that is very, very important. You know, everyone will go to a doctor, they'll come with things and they don't follow. Next time they come again, they tell, I've been going to do this time, but it's not there. So that thing to make them follow, you should have someone to be behind them.
Absolutely.
Simple example is, it is very common for people to pick up smoking once again at the end of 1 to 2 years after a heart attack. They start with a 1 or 2 cigarettes a day and it goes back to the previous habit. So in other words, awareness is there, action is taken temporarily, but afterward they lose track of it. That is the difficulty we have, and that is the power of the habits one creates amongst ourselves. So be watchful about the habits.
Can we break that habit?
That's a different ball game altogether. We should discuss it some other time. I think we should be discussing what is it?
Care.
CaReMe diseases today.
Focus on
Yeah, yeah.
Yes. Considering that there is asymptomatic stage, we should take care of them. The symptomatic stage, we should take care of them. Be it diabetes, be it metabolic, be it renal, be it cardiac. It's a huge canvas for all of us individually, but also collectively also it is a huge canvas.
Now slowly CaReMe will include some other organ also now. They're trying
Liver.
to do it now.
Liver is coming in.
Liver is coming into this.
Yeah.
Yeah,
right.
because fatty liver, or what we called as a fat deposition in the liver in layman terms.
Yes.
There are different terminologies like MASLD coined for that.
Muscle.
So that
Muscle
is-
one which is going to come in.
So that is going to come in with the CaReMe. So it will become CaReMe L.
Oh, okay.
Yeah, CaReMe.
Okay, then another doctor should be here.
Yes, a gastroenterologist might be needed also.
Yeah.
So what its simple terms means, initially the cardiologists thought they are the best. Now the nephrologists thought they are the best. Then the metabolic thought they are the best. So now even the liver people also think that they are the best or the
True.
worst. I don't know, but
Sure.
they are going to get included because it's the whole system is getting involved with the same hemodynamic problems which are there in the body. It's the metabolism which is going to cause problem to us.
Nagraj sir, I want to understand how big is the burden of CaReMe diseases in India?
In fact, the diabetologists and the nephrologists should be able to kind of elaborate a couple of points that I'm going to say. I would say that hypertension is a very common problem in India. 1 out of 5 adults is labeled as high blood pressure patient. In fact, if you include the pre-hypertension, wherein the blood pressure is still in the borderline, the number can go up so enormously. High cholesterol, or dyslipidemia as we call it, where there is abnormality of the fat fractions in the blood, that's also supposed to be in the range of something like 80% according to the in the ICMR studies, in fact. If you go to the diabetes section, you find that ICMR studies have shown that nearly something like 15 plus 15, something 30 to 40% of the population have either diabetes or pre-diabetes, suggesting that in case of ischemic heart disease, that is also increasing in number. Now, what we find very intriguing and very troublesome is these diseases are occurring at a younger age, something like 10 years, 20 years ahead when compared to the past. And these people, these diseases are occurring in a very productive years of life. Say, for example, if a person develops a heart attack at the age of 35 to 40 or 45, he's still not retired. And he remains disabled and remains at home and dependent upon the family to, sustain himself economically. What would happen to the society, which we claim that we are a young society? So younger population and kind of a diseased population or unhealthy population is not good for the economy of the country. That is the reason why we are worried about CaReMe diseases. Okay, so that's the problem that we in WHO parlance they call it DALI or disability adjusted life years is huge. Whether the person develops a heart attack, person develops a paralysis like a stroke, or develops diabetes related complications or kidney related complications. So suffice to say here, the amount of money that the government spends on each person when he suffers a heart attack, suffers a stroke, suffers a renal problem is so large that it will run into several millions of dollars. So one should be very worried that we should manage these patients, manage the population, not the patient. They are not still patients, and that is the challenge for the doctors community and the society and of course the government.
And as we prior said, until the patient, they won't visit you.
Yes.
So that's the problem. Yeah. Sanjeev sir, can you tell me like how it is a replica for your clinical practice?
Okay, this is very good statistics which they have given to us. All over the world there are around 500 million diabetics.
500 million?
Yes, and 64 million heart failure patients all over the world. That's the statistics I'm talking. You know how many renal failure patients or CKD patients?
Much more.
800 million, more than 800 million. What it means is in Indian statistics, together we are more, but it's not good. 1 out of 10 person will have a kidney failure. And any diabetic in your family, 40% of them will surely develop chronic kidney disease. And once a disease in the kidney is a lifelong disease, it's irreversible. So that's the problem with identification. Until 90% of your kidney is gone, you don't have symptoms. Person having diabetes, 40% will go to have a kidney disease. And those people who have a heart disease, 40% of them will have a kidney disease. So what it means is, it's kidney disease and heart disease are the sides of a same coin. You cannot change them. When you flip it, either you have a kidney disease or a heart disease. The flipping air is your metabolic. You're flipping into the metabolic disease. So that's the incidence which you have to understand. So anyone in your family has a disease of one kidney or two kidney or any diabetic relative is having a diabetic, blood pressure, heart failure, be very careful. Because you have a lot of people going to have kidney disease when you compare it to heart and the diabetes. So very important for us to understand this, that 1 in 10 is what you have to be very careful.
It is
And it's a silent disease. It's called as a silent disease. We call as hypertension as a silent killer, silent disease.
Yes.
But kidney is most silent,
as much
noiseless.
as much.
Noiseless. It's a noiseless thing which comes in and you don't even know you have a kidney disease.
That's right.
That's a
That's
problem with the kidney disease.
Also, it is a fact that people who develop kidney failure, they die because of the heart related issues.
That's the reason the nephrologist doesn't get blamed at all. It's always the cardiologist who gets blamed.
So in other words, when we prevent the organ dysfunction, the final exit from the world will be lesser. That is the idea.
So what I understood is, as sir already given the example of home and the owner of the home and the child of the home, it's better to deal with the owner of the home.
Yeah, go ahead and talk to her.
You deal with the home, not the owner of the home.
Let me go to ma'am only then. Ma'am, your perspective on this.
Yeah, so as you're talking about the prevalence of these metabolic problems in our country, few of the metabolic problems they have already spoken about. But when we talk about the burden of diabetes, there are about 101 million in our country, and we have 136 million with pre-diabetes. So that's a huge number for our country to deal with, especially when patients pay out of their pocket for their treatment. So the major problem which happens when you see these patients is not just their treatment, but they are losing that much of money on their treatment. They are getting cardiac disease, they are getting renal disease, and it is a huge burden to the whole family. Many of them may lose their jobs because they may get complications, they may not be able to do their work. So all these are other problems which happen. So that is why also, if you see, most of our patients who have diabetes will also have dyslipidemia. They'll have high triglycerides, which is a very common problem in our country. They have small dense LDL, which is a type of a bad cholesterol, which may not look so high as per the value. So many times the patients come to us and tell us that our reports are looking normal, but it's actually the small dense LDL which is more harmful, which causes more problem to the heart. And if you talk about the commonest cause of mortality in patients with diabetes, it is cardiovascular disease. But the thing is, it's just not cardiovascular disease which they have when they die. They may have other complications, including renal disease. But when we are talking about renal disease, as I already spoken about, they may have eye disease as well, they may have nerve problems as well, and they may develop peripheral arterial diseases, because of which they may develop diabetic foot problems. They may have ulcers in their feet, which can be infected, which can get infected, and can cause multiple other problems. And also, it will make them bedridden. So all these problems are also there along with these. So it's just not diabetes which is there. When we say 101 million diabetes or 136 million pre-diabetes, we're just not giving a number. We are giving a number where all these patients who can be having complications or who may get complications over a period of time, who may get renal disease, nephropathy, who may get cardiac disease, but they may get multiple other problems as well. So that is why it is important, because when we talk about burden, we also have to talk about the financial burden, because we think that it is very easy. We write medicines for the patients. We know that the cost of medicines is huge. So all that is also a big deterrent. When we talk about treatment, we will see a lot of patients defer or don't take the treatment for the reason of the cost. And many times it is a financial thing, which is a reason for which they wouldn't have taken the treatment. They wouldn't have taken their medicines properly, or they wouldn't have followed with a doctor. So when we are talking about the preventive health checks or going for regular screening, many a times the reason is not just that the patient does not want to go to the doctor, but they may not have the means or the finances to do that. And also the accessibility to doctors. So that's also a major problem which we see. So that is why when we talk about burden, it is also the other burdens which are there. And as we already, we have also spoken about, that it's also the liver disease burden which is there along with this metabolic disease, apart from the cardiac and the renal which we are talking about. And that also could be a major cause of morbidity as well as mortality in these patients, because they may land up with liver failure, cirrhosis of liver as well. And that also is a problem which can happen in many of these patients, apart from what we are discussing with the other complications as well.
In fact, the number of amputations because of peripheral vascular disease is much more than what you lose in the war.
Yes.
You know that. That's a simile. The number of amputations what happened in the war is lesser when you compare with the amputations what they are with the diabetic peripheral vascular disease. So metabolic disease affects everywhere. It's cardiovascular.
Yes.
It's not only the heart, it's all of the vessels also which are involved.
Too complicated.
It's
Yes,
not complicated, it's simple to understand. It's very important for us to make people understand that
Yes, that's
they
right.
have to control. People are fear mongers. They get the things into their brain only if it is fear is created in that
And it's important they understand the connection.
connections.
The main importance is that, because many times when we talk to our diabetes patients and tell them that it is mandatory for them to screen their eyes, kidney, to screen their hearts, or the nerves, they will say, why I should screen that? Because I can see properly with my eyes. Why should I screen? So they don't understand that these diseases can affect the other organs, and it may be interconnected. That is a connection which is there, which they may not be aware of, and that is the reason they don't get themselves evaluated.
Yes.
So it's not just that the patient does not want to, it is many a time they don't have the information. They don't know that when you have diabetes, every year you have to screen your kidney, you have to screen your eyes, you have to check for your cardiac system, you have to check your nerves, you have to check whether your vessels are proper, whether there is any lack of blood supply, any problem with the blood vessels. So this is the awareness which has to be there. And until unless people are aware, and many times they don't do it just for the lack of awareness, not that they don't want to do it.
So now let's discuss about the symptoms. So Nagaraj sir, can you tell us like what are the early warnings for these heart diseases for all of us? Yeah.
It's a very tough question. Basically, symptoms of heart diseases are very many, but I would like to concentrate only on symptoms due to lack of blood supply, what we call it as an acute myocardial infarction or a heart attack. Here, the person usually has a chest discomfort located in the center of the chest, and it is not in the small area like a pinprick. It will be a large area of something like a fist size. It occupies the left half of the chest more than right half of the chest. It could be something like some radiate to the left shoulder and left arm, or it can be sometimes the right arm and right shoulder. It can very rarely can radiate to the neck also. It is not something like pinprick and disappears like that, like a flash. It is a continuous, gradually increasing pressure over the chest and reaches the zenith over about something like 5 to 10 minutes time, and it goes on for about half an hour's time. Heart attack pain does not go on for hours together. It cannot go for days together. It does not change with respiration, change with breathing, change with position, change with the movement of the body. They're all non-cardiac, not related to the heart. So the central chest pain, which is more on the left side than on the right side, and it can get radiated to the left arm or the right arm, and it starts gradually, builds up, it kind of a rhythm, and reaches a plateau and gradually goes off. When we walk, if it happens, it is called angina pectoris, it is a warning. When I walk faster, it comes. When I walk slower, I can walk long distance. It doesn't come. So am I better off? Yes, it could be, but there is a warning already. When you walk faster, it appears. When I walk to the second floor, it appears. When I stay myself in the first floor or the ground floor, it doesn't happen. Am I better off? No. You already have been warned. When you go to the second floor, your body is complaining about it. In other words, there are warning signals. Many a time, they come as a kind of a warning to the body, but patient do not heed to those advices by the body. He ignores, and what comes as an early warning, it becomes a bad warning. One rushes to the hospital, and sometimes he may die on the way to the hospital. That is the worst thing to happen for, some of the VIPs of the city. You other day saw happening, as they are rushing to the hospital, he could not reach the hospital. In other words, the early warning signals have to be observed carefully. And it is not just discomfort, it may be difficulty in breathing also. A person who was able to walk up to the third floor, if he has difficulty in walking up to the first floor, he was able to run, but he gets breathless when he is walking on a flat ground. This is again a warning sign. I am walking, I suddenly fall down with the giddiness. It is a warning sign. In other words, we can list several of them, but suffice to say here that any symptom or anything that is very unusual for you, you eat everyday good food like pulao. Why an acidity should be there eating pulao? Many people tend to say that they got the acidity, that's why it is not a heart attack, it is a pulao that I ate other day and all this. So it is that kind of education should come to the public so that the early warning signals are heeded to and they take proper precautions. But unfortunately, many of the diseases are in incubation. For example, atherosclerosis, which causes a heart attack, it is in incubation for nearly 30 years, or 20 years, or maybe 10 years. So it can start around the age of 10 to 15, 20. If we do what is called a calcium scoring or coronary CT angiogram, you'll be able to find these minor blocks. They are developing gradually. We cannot subject all our people to CT scans or coronary calcium score. And as we say, some of the patients, like diabetes patients for a long time, or hypertensive patients for a long time, cholesterol high patients for a long time, they may be subjected for early warnings that may not be producing symptoms, but we are able to establish the presence of disease, suggesting that it is the doctor, when he sees a particular person, can decide what is in the best interest of him what kind of evaluation to be done, including a test, which may be sometimes expensive.
Sanjeev sir, as you earlier said, so it's not a symptomatic. The kidney, after some times we will get to know about what exactly happening. We won't get to know earlier. So how people observe it? How people get to know that they have a kidney problem then? What's the symptom? Early symptoms.
There's no early symptom. It's always a late symptom in kidney disease.
Okay.
The late symptoms are like swelling in the legs, puffiness in the eyes,
Okay.
or you try to go to urination very frequently in the night. Morning you may not go.
Oh, okay.
Or you can find a froth in the urine. Or you can get breathless when you walk around for a longer distance. These are all late signs. There's nothing called as early signs for the kidney disease. It's always 90% of your kidney is lost when you are having all these things. Some diseases like glomerular disease, we can have all this facial, this one. So to detect a kidney disease, it is always two tests which you have to do.
Okay.
Very simple. In blood, we call this as creatinine,
Okay.
or we do call it as EGFR, and urine, we do protein. It may cost you around 300 rupees. That's it. Do it, then you can detect your kidney disease. Or you have to do an ultrasound scan and see whether your kidneys are fit enough or not. So, symptoms when you get for a kidney disease is always a late symptom.
Literally.
So,
No early symptoms.
no early symptoms. So,
Okay.
if you want to detect kidney disease very early, check. Check your kidneys.
Regular.
Simple. Creatinine and urine protein. Then when you do a creatinine, the hospital will give you something called as EGFR, which is a calculated function of kidney. Then you will come to know whether you have a kidney disease or not.
Okay.
So when you talk of kidney disease, it's always a late symptom. So be very careful. Any family history, anyone is diabetic, anyone who is having hypertension, anyone is on chronic medications, a lot of medicines, who are on alternative medicines, they have to be very particular about taking the test faster, earlier.
Especially the metallic powders,
What do
The
you use
drugs
for
which-
your face? Mercury? They are all very bad for the kidney.
It affects kidney.
Yes.
So one should be careful. No. Yes.
Yeah.
Pramila ma'am, same question to you as well. So how people will get to know about the diabetes in a earlier stage? How they'll identify it?
So, as we are all discussing, that many of the diseases, including diabetes, may not have typical symptoms.
Yeah.
So, when we are talking about, like we were talking about cardiac disease, we know that if a patient with diabetes may get a heart attack or gets a heart attack, they will not have any symptoms sometimes. They may just come with end stage problem or when they already have developed heart failure.
Yeah.
Because many a times we see that they have silent MI, that is called as that they will not have a typical chest pain, what we think that every patient will get, because they will have neuropathy and they'll have silent cardiac problems and we will not know, but they may have some other symptoms which Dr. Nagaraj already alluded to. When we are talking about detection of diabetes, now it is very important, as I was already talking about, that we have to screen, because many times patients who are overweight or obese and they have typical symptoms of insulin resistance where the insulin is not working in the body properly, like what we see blackish discoloration in the neck or in the axilla, which we call as acanthosis nigricans. So these are typical symptoms, and these patients may not have any other symptom which could suggest. So they may have just obesity, they may be overweight, and they may get a routine check done and they may come to know that they have diabetes. This is one category. The other category of patients may have typical osmotic symptoms of diabetes or high blood glucose, like they may have more urination, they may feel very hungry, they may be eating more, but still they may be losing a lot of weight, which is called as a catabolic state when the blood glucose values in the body are very high. So these are what we call as typical symptoms of diabetes, what we say polyphagia, polydipsia, polyuria. So patient will have more urination, will eat more, and may lose weight, and may feel that he is very lethargic or fatigued. But there is a huge number or a large number of patients who may not have symptoms. So they need to get checked. So what we recommend that everybody, at least after the age of 25, should get their glucose values checked once. If they don't have any tendency or they are normal weight, they have no family history, they have no features of insulin resistance, if they are normal, we can check every 2 to 3 years. But if they have some borderline values, which we call as pre-diabetes, so those are the patients who may need to get more frequently checked, maybe once in 6 months to 1 year. Or if a patient has already got a test done and they have found that their random glucose values or a value which was checked just once has been found to be abnormal, then they should get themselves checked properly with a fasting, postprandial glucose value with a HbA1c to detect whether they have diabetes or pre-diabetes. So it can manifest in two ways. One is asymptomatic, one is symptomatic. Symptomatic is the easiest to detect because they'll come with symptoms, but asymptomatic needs a routine screening, especially if you are overweight, if you have family history of diabetes, if you have acanthosis nigricans. It's a good idea to get your glucose values checked once to check if you have borderline tendency also, because then we may tell you that you may be needing more frequent monitoring. Even if you don't have diabetes, it's a good idea to check so that you know that you don't have it today, but we need to follow lifestyle and take care of it and get it regularly checked. So that's why it's important that we don't wait for the symptoms, as all of us are alluding to, that we should try to screen ourselves and know that if you are overweight, if you have dyslipidemia, if you are not doing exercise, you are the right person to get yourself checked. That doesn't mean that if you're doing exercise and you are not overweight, you don't need to check. Then also you need to check. Everybody needs to get it checked so that we know, because even normal weight people who are doing exercise may also have diabetes. It doesn't mean that they won't have diabetes or they don't get diabetes. So they also need to check themselves. So it's the screening which is the key rather than waiting for the symptoms to happen.
Argue and also add on supplement to whatever she said so far. American Heart Association calls now essential 8.
Essentially.
Essential 8.
Okay.
You ask me what are those essential 8?
Yeah.
One is maintenance of the body weight. To maintain that body weight, you have to make sure that you eat healthy,
Okay.
and you have to exercise healthily, and then you should stay away from tobacco. You should make sure that your blood pressure is checked and your blood sugar is checked, your cholesterol checked, and you sleep adequately. So these are 8 essential habits or essential points for every one of us. By doing this, the population, it looks like it remains healthier. And as a long time ago, in fact, one of the senior professors, American physician, said that if you get a heart disease at the age less than 75, it is your fault. If it is beyond 75, then it is the nature's willing. So before the age of 75, if somebody gets diabetes, somebody gets high blood pressure, it is a man-made. There's what is called the epidemiological transition of the population, wherein with the rapid urbanization, rapid lifestyle modifications, including the transport changes, sedentary lifestyle, eating tobacco, rather smoking tobacco, eating more salt, and affluence, like all of us, all these cause lifestyle disorders. So earn more, spend less, remain healthy.
Remain healthy. So till now we spoke about the problem. So let's ask for the solution as well, because the specialists are here. So Nagaraj sir, so how do the actual CaReMe plan look like, the treatment look like?
One is a non-pharmacological approach, managing all these so-called the targets that I was talking about in the previous section, to make sure that they are at the target levels.
Yeah.
Blood pressure is good, cholesterol is good, sugars are good, you are active, your body mass index is normal, you are healthier, you are sleeping well, your stress levels are good, work-life balance is good. Despite that, if somebody develops problems like a heart attack, we have a treatment for that also. After heart attack management, if a person develops a heart dysfunction, we have treatment for that also. Beyond heart dysfunction, you develop a heart failure, there are treatment for that also, including something like, pacemaker therapies or even transplant of the heart also. In other words, as we scale up in our management strategy, it adds to the cost of the treatment, adds to the physician's intervention and patient's capability to take care of himself. and the society's ability to afford such treatment in our context. So, considering all this, we feel that while the drugs are available, they should be meant for those who are in need of them. And like there are several drugs that are available here. I'm sure when we talk about diabetes and renal disease, we'll be talking about the SGLT2 inhibitors and drugs like that, wherein they have made a phenomenal difference to cardiac patients also. So that's why we say that I'm very kind of fan of lifestyle management in addition to the drug therapy. And most importantly, more than that, patients and the family should also be counseled. Enrollment of the patients into his own treatment along with his family goes a long way in the total management of a particular individual. I rest my case at this stage.
Thank you, sir. Thank you so much. Sanjeev sir, can you tell us like how the kidney treatment should be taken?
Okay.
Kidney treatment is very simple actually.
Oh, okay.
You know why? When you talk about treatment of kidney disease, you will talk about lifestyle changes, very important. What Sir was trying to put across the
Yeah.
8 things, what he is trying to tell you, those lifestyle changes are very important for us also. Where we talk about the diet, we talk about the exercise, then there are a few tips to keep your kidney very nice.
Okay.
So, one very important is drink plenty of water. Yeah, this is very important. How much is very difficult to tell, because if you see the practical solution, I'll give it to you. Whenever you pass urine, it should be a colorless urine. Then you are drinking a good amount of water. If you pass yellow, pale yellow, then you are not drinking good amount of water. This is typical common sense, not by medicine. It's told by my elders, not by medicine. So many tips, they were doing that before. Then water is very important where you drink. But once you develop a kidney failure, you have to go for restriction. So all depends on the situations.
Yeah.
Then the other important tip is no smoking, no alcohol. Get your blood sugars as best as possible to control. I don't tell perfect control, as best as possible. Try to keep your HbA1c if you have a kidney disease to around 6.5 to 7. That's adequate, ma'am.
Yes.
Yeah, that's what I do for my patients. Blood pressure. We try to hop on blood pressure treatment. Actually, nephrologists are better for controlling the blood pressures than the cardiologists. I can tell that, sir.
Sure,
Yeah.
go ahead. I will argue against it.
Because most blood pressures can be very adequately controlled, and you have to control to a stage where it should be around 120, 130. So that's where you have to control. Don't get too much low, too much high. Too much low also will cause problem, too much high also will cause a problem. Then medications, what you take, should be very adequate. Don't take unnecessary medicines, painkillers, out of the counter medications, which are bad for the
Kidneys.
There are few alternative medicines where we are not the expert. They believe in that field of medicine. I don't believe it. I may respect their field, but we see a lot of patients with that medicine coming to us with having a problem with the kidney.
Yeah.
So we have to be careful on that. One more very important tip, which I always tell them, is don't take advice from other patients.
Yes.
Never.
Perfectly said.
Absolutely, don't
Absolutely
take
agree.
advice, isn't it?
Yes.
What is best for you may not
Is
be
designed for you.
It is individually
happens.
designed
Yes,
for
yes.
It happens.
you. Don't take that advice. So these are the lifestyle which I'm talking about. From medications point of view, Madam will tell about the what all medicines to be used. But as a kidney protective medicines, there are 4 group of medicines which are very, very important now. One is called as SGLT2 inhibitors, where they protect your kidney. They protect to an extent where almost 30 to 40% of patients will not go into renal failure or dialysis. So that's the belief in that medicine. Then you have medicines called as DPP4 inhibitors. Then you have something called as ARNI, sacubitril and valsartan. The most important for all the kidney disease patients is RAS inhibitors. These are 4 group of medicines which are good for the kidney prevention, so that the progress of kidney disease is halted. Remember, once a kidney disease is always a kidney disease, it will progress.
As you said.
Yes, in case the patient doesn't progress, it is because he has died because of the heart attack. Isn't it? So that's a practical
Yes.
aspect. That's what is happening. So these are the medicines which you have to take care. If all these things doesn't help, okay, ultimately he'll land up in a stage where he has to be on dialysis. Yes. Dialysis is something where you have to do 3 times in a week, purify the blood, then put the blood back. Here, it is very important for us to understand that dialysis is not painful at all. Absolutely painless one where you can get dialyzed. There are people of extreme age, children, younger group, and elderly people also on dialysis. They come, get dialyzed, and go back. Those who work, they can get dialysis in the night. Those who are housewomen, they can get dialyzed when they are free. And mind you, why we tell to take care of your kidney is all the treatment for kidney disease is expensive. Dialysis is expensive. Where in India, almost 50 to 60% of them pay from their pocket. It's not that. Government has lot of schemes, lot of Pradhan Mantri Ayojanas where they have put for dialysis as a treatment modality. I think till January, some 326 lakh people got dialysis done properly. All the 36 states and union territories have dialysis. All of them, each district, each places they have, taluka places have dialysis. In Karnataka, we are through. All the districts have. We have somewhere around more than 900 dialysis stations where everyone gets dialysis free of cost. What we have so many free bhagyas, if they give medical bhagya free to us, we'll be very happy. So, then in India, almost we have 1,700 dialysis stations, and all of them are getting this. Dialysis is not only the treatment. More superior to dialysis is a kidney transplant. It's one of the diseases where you have a perfectly normal life, no problem. Anyone in the family can give, or anyone who has a brain dead, or we call this as a deceased donation. Anyone who dies, who's young, who's willing to donate, can give, and we can do a transplant. Transplant also is expensive because after the transplant, to keep that
Care.
kidney,
Yes.
you have to be very careful. Infection is one and rejection is one which you are always worried. So I feel instead of going to dialysis and transplant, better take care of kidney before. Especially the people who have diabetes, blood pressure, family history of kidney disease and diabetes and blood pressure. The third thing which I always tell is get your kidney checked every year. You celebrate your birthday, make sure you test check on that day itself. That will make common sense for everyone to check their kidneys. So
Perfectly said.
this is one best way to keep.
Prevention.
You always get a ring from insurance company, isn't it? You have a car, you make an insurance. 6 months before the insurance is over, they could get your call to you, isn't it?
True.
So why don't you call your own guy whom you are more worried and tell him, boss, last year you have checked it out, let's check this year also. That's one-to-one interaction which I'm talking. You're talking to our loved ones where people are trying to help you out, get your kidney tested once in a year at least. So this makes the treatment very effective and we can prevent it from further progression of a kidney disease.
That's a good resolution
Yeah.
to make.
Yes.
Actually.
Yeah,
Every
you have
birthday, go to your doctor and
No, don't go to doctor.
Get
Go
your
to your
kidneys checked.
No. Go to your doctor. Go to your family doctor.
Family doctor.
Yes.
Anyone can help you out in doing
Yes.
this. So, lifestyle changes, medications, dialysis, transplant. These are four things as a treatment for kidney disease.
Pramila ma'am, what are the precautions for the metabolism so that we don't get heart and kidney diseases?
So, as we were all talking about, that cardiac disease can be treated, renal disease can be treated, and as already I spoke about the other complications which we get because of diabetes. So, it's very important that we treat diabetes on time and properly. So, what is important that when we talk about diabetes treatment, we say that we treat diabetes early, treat it properly. So, we use the terminology hit early and hit hard. So, hit early means what? That when the patient gets the diagnosis of diabetes, that's the point of time when the treatment has to be started. Many times we see that the patients don't take their treatment on time and they delay the initiation of diabetes treatment. Many patients will think that only lifestyle modification will take care of that, but that's not the case. So that's why we have to also understand that when the patient gets the diagnosis of diabetes, the endocrinologist or the diabetologist has to decide that what is the best management strategy for this patient, and we have to start the treatment on time. We have to hit hard. What is the meaning of hit hard? That means that you have to give the proper treatment on time. So when we are talking about cardiac and renal protection, we have medications which can have a beneficial effect on the kidney and the heart. So if you talk about the medications, some of the medications we already spoke about, that is SGLT2 inhibitors, which are one group of anti-diabetic medications, which also have a protective effect on the kidney and the heart. We have other medications also for diabetes treatment, that is GLP-1 analogs, which also have a good effect on the kidney and the heart. And both these medications, that is SGLT2 inhibitors and GLP-1, also take care of your weight. So these are the two medications which also take care of the weight and help you to lose weight as well. That way, they not only protect your heart and kidney, but they also help you to reduce weight and take care of your diabetes. So these are the medications which definitely need to be offered to these patients, but not to forget, lifestyle modification has to be continued. So whether you have pre-diabetes, you have a tendency for diabetes, whether you don't have diabetes as of today or pre-diabetes as of today, or you have developed diabetes and complications, lifestyle modification has to continue. You have to follow healthy lifestyle. You have to take care of your diet. You have to exercise regularly. And one thing we always forget, adequate sleep. At least 7 hours of sleep is a must for a good metabolic control to take care of your diabetes, because a lot of time people don't take adequate sleep. And that is one of the reasons a lot of metabolic problems happen, especially sleeplessness leads to uncontrolled diabetes as well. It can exacerbate your hypertension also, and also it can lead to a lot of other metabolic problems. So it is important that adequate sleep is there. We devote time to our health, we do regular exercise, and we also see to it that we eat healthy, because it's a thing that people tend to eat outside on weekends, and they think that that is the most healthy thing they can do for their health. And we know that we have a hedonic center in the brain, which gets more happier when we eat junk. So we should not try to make our hedonic center better, but we should try to see that we eat healthy and sleep on time, take adequate sleep and take good diet, which is healthy, which includes low glycemic index carbohydrates, high fiber, and less of fat, and total zero trans fats. So that's the healthy diet we can follow. As Dr. Sanjeev also said, that adequate water intake, that is also very important. But along with that, this is also the thing which we have to see. And we have to also see that we control the amount of calories we eat. Healthy diet does not mean that we can eat as much as we want. We have to have a small plate so that we eat less. Because if we take a big plate and then we tend to think that the plate should be full and we tend to eat more. So we should take a small plate, eat less and eat healthy and sleep better.
One thing I want to add for all three of us.
Yeah.
Always, whether you have a heart disease, kidney disease, or a disease with metabolism, the family support is very important. So all of them will be in depression. Psychologically, you require someone to boost you up. So the family support and the support from the friends is very important. So these things make a whole thing good for everyone.
Actually, it was a wonderful, informative session actually. So as
No, we also have published from JSS, where I was working. Previous to that, I was working in MS Ramay. We have published also the mental scores, Hamilton score for people who had a heart attack, and we demonstrated that it is higher in those people who had a heart attack when compared to the control group, suggesting that stress plays an important role.
Absolutely.
And one should have a good emotional quotient or a work-life balance, I guess.
it was a very informative session with you all actually. So as Sanjeev sir in the first he said, I'll make simple for you guys. Actually it became very simple after understanding what exactly the problem is and where exactly the solution is and what exactly we have to do to go through this. So it was a wonderful session, but I just want to ask you one piece of advice to our audience out there, to all of us, from the specialist, heart specialist, Nagraj sir.
I already suggested, in my opinion, essential 8 principles that were very powerfully put in by American Heart Association, are simple rules to go by, and it will be applicable to all of us, healthy as well as unhealthy, young as well as old, and with disease or without disease, suggesting that some of these 8 principles that I was telling you in the previous sections, it should help all of us to remain healthy. After all, when we are on this earth, we are supposed to be productive, and productive to make sure that our society remains healthier and happier. Thank you.
A piece of advice for all of us, Sanjeev sir.
Very simple advice. Please check your kidneys regularly by doing only 2 tests. One is creatinine and urine routine with urine protein. If you have a doubt of kidney disease, approach your physician first as early as possible. If you have symptoms of kidney disease, which I've told you so many, you can go and approach your doctor very early. The important thing is, if you have a kidney disease, don't stop working. Please work. That will be much more mentally relaxable to you. And I would expect the relatives and the friends of a patient with kidney disease to give wholehearted support to him, support him thoroughly, whether it is financial support, psychological support, or any support which is going to help him make his life better. We are all here to take care of you. As a nephrologist, I will assure you that I will take care much better if you come to me early.
Pramila ma'am, your piece of advice to all of us.
So it is very important that when we talk about diabetes or metabolic health, first thing which always is very important is lifestyle modification. Follow a healthy diet, exercise regularly, take adequate amount of sleep, and reduce the screen time. And if you have developed diabetes, please take care of your diabetes, just not by only following lifestyle modification, but also take good care of your diet and exercise. Along with that, you have to take medications. So whatever medications have been prescribed by your doctor, please take those medications along with your lifestyle modification, which will help to take care of the diabetes well. And also get yourself checked regularly. Every 3 months, we need to do a HbA1c and a glucose value checked, so that we know that what is the control status of your diabetes, and get yourself checked for all the complications which we discussed at least once in a year, to know that if your kidneys or eyes or nerves or heart, any organ is getting affected, we can come to know about it. So get yourself checked regularly, go to your doctor regularly, and follow the advice.
To all the doctors out here, so this is my personal experience after the session and before the session. I want to share this experience with you guys. When we started the session, I thought CaReMe diseases is cardiovascular, renal, and also metabolism. And later stage I got to know it's cardiovascular, kidney, metabolism. And then I got to know it's care, metabolism. So that is the main key, that is the center of it. But in the last, I really am feeling like it's care me. At last it's care myself. Care yourself, observe your body, know yourself, get regular checkups, and be healthy.
Perfectly said.
Absolutely.
Absolutely. Correct.
Awesome.
Thank you so much for joining us today. It was a wonderful
Thank you.
session. Thank you so much. Thank you to the audience. Thank you so much.